So the story of Rumpelstiltskin follows an evil imp who gets power over a woman because he does a task for her. She's a straw spinner who's trying to turn her straw into gold on the promises made by her father to the king. Rumpelstiltskin offers to do this, but in return for that, he requires progressively more and more valuable things from her, finally asking her for her firstborn child. But he also says that if she's able to guess his first name correctly, she doesn't have to give over her newborn. So she goes through all the possible names she can think of to no avail, before finally, by some stroke of luck, her servant overhears the imp talking about his own name. She says it to him, Rumpelstiltskin, and all that power that he had over her disappears instantly. Now there's a medical corollary to this story called the Rumpelstiltskin effect that was coined by two academics, Always After and Alan Levinovitz, to describe the process of naming ailment that someone's suffering with an actual diagnostic label, like saying this person has anxiety, and that itself, the diagnosis itself, providing some therapeutic relief without actually having taken any treatment beyond that, therapy, drugs, whatever. And I think that's a really, really fascinating idea, and I wanted to discuss that a little bit more today. In the effort of being precise as well, I should probably say that this isn't a concretely proven effect, it's a hypothesized effect based off a few different studies and their personal experience. And also, it isn't necessarily that the effect is always going to be positive. It can be negative as well. There's a few different mechanisms as to why there would be some kind of therapeutic effect from literally just getting a diagnosis itself, and they outline these three. Firstly, the kind of clinical lens itself. So, whenever you describe someone in everyday language, it might come across as quite stigmatizing if you say someone's lazy or something like that. But medical terminology, like formal diagnoses, never kind of go over into those value judgments. It stays at quite somewhat robotic, somewhat mechanical level that allows you to be kind of separate from your emotions with the diagnosis. The second mechanism is the most fascinating to me because it's about taking on the role of the sick person, which is essentially this kind of preconditioning that our bodies might have to, once we get a diagnosis, we kind of presuppose that there's going to be some treatment coming in after, and so naturally your body sort of adjusts to that happening. You kind of get some of the effects of expecting treatment before ever having actually received it. That's a really interesting thing. Again, this is kind of telling you it's definitely still a hypothesized effect as well, because that is a bit more left field, but it does seem plausible, right? It seems plausible. And the final thing, the third thing, is on the most obvious thing, which is that relief you get from uncertainty once you have a label for it, mainly because you know that there are other people who have gone through it, there's a community behind it. It allows you to situate your experience in the context and community, and that's what allows you to feel like you're not going through this alone. In a follow-up Substack article to this effect, Ofta was writing about a very prominent schizophrenia researcher called E.F. Torrey, who had actually basically found the same effect many decades ago, and had even used the same analogy for it of Rumpelstiltskin, which I think is really fascinating. In that piece, E.F. Torrey talks about a lot of interesting examples, one of them being around the differences between drugs and psychotherapy. So he's talking about how drugs are interesting, like a drug like penicillin, the doctor or the patient don't actually need to know how it works for the patient to receive the benefits of it. Whereas with something like psychotherapy, you as the patient and the doctor need to have some shared way of communicating to each other about the topic at hand, and that presupposes some shared culture or worldview as well. And then he gives this example of if you're an American tourist and you go to some witch doctor, and that witch doctor says to you, your ailment is a result of ancestral possession, it might not really make a lot of sense to you. It might not resonate as much as it should. And on the flip side, if you are a tribesman who then goes to a psychiatrist in the US and they say to you, your ailment is a result of your fear of failure, again, it probably won't resonate in exactly the same way. And having that kind of shared culture, which can be described through language, is very, very important and a very unique bit of psychotherapy that I hadn't thought about before. It's quite interesting because basically what E.F. Torrey is saying is that psychiatrists and witch doctors are very similar, and he finishes it by saying that it's not something to denigrate psychiatrists but something to lift up witch doctors, which makes a lot of sense to me. But it's very interesting coming from him because he's one of the major proponents, he's probably one of the fiercest supporters, maybe even the first one, of the biological hypothesis of schizophrenia, that it was like a mechanistic development, not just an environmental thing or some more abstract thing. It was something that actually happened in the biology of a human. And for him to then be going to more of this side of psychiatrists and witch doctors actually have a lot more in common than you might think is interesting. It's one of the reasons that I love psychiatry so much, because you get people who blend together this kind of more artsy humanistic side with the more mechanistic biological side, and it always makes for very interesting interpretations and conclusions. As I mentioned at the start as well, right, it's not necessarily a good thing to get this diagnosis. Like, there are also bad effects associated with them. If you get a diagnosis of something like autism, it might leave you feeling stigmatized or feeling like you're a bit more alienated from other people. And there's nuances there as well, like in terms of when you receive the diagnosis. Like, if you're of a younger age, or even if you're just at a stage of life where you're not really ready to hear that diagnosis, it can become either like a self-fulfilling prophecy or something that you feel the need to play up to, like a box that you basically put yourself in. And I think that kind of comes at the discretion of the psychiatrist in question to know if that patient is ready to get a formal diagnosis. I assume so, I guess. You know, we've gone from how it was before, where no one really got diagnosed with these kinds of mental health conditions, to now maybe overcorrecting for it. I think maybe there are people getting overdiagnosed and taking resources away from more serious sufferers who probably need that more. But I'd rather we're in that overcorrection period than not getting it done at all. And I have faith that at some point we'll kind of self-correct into the middle ground where it should be. This final point, I'm not even sure if it's a bad point necessarily. It's more like a point of caution, which is about what gives a diagnosis that feeling, that level of importance, is that it comes usually from a doctor who has a position of authority, right? But since the rise of the internet, and more recently with AI, you know, you could self-diagnose yourself through Google, WebMD, the NHS's website, and now most recently with like LLMs in a more advanced way. That kind of replacement of medical authority to me is very interesting, and is something that we really need to consider, because a doctor has earned the right to have that authority, right? They've done a 5-6 year whatever degree, they're maybe even further into their career. They've earned the right because they've seen so many patients. You hope that with WebMD or the NHS's website that a proper healthcare professional who has done that training has put that information up there. But then with these LLMs, right, which are essentially ingesting huge amounts of data, can you really trust them? Especially when I'm sure anyone who's watching this who's used one of these chatbots, they seem to be very jagged and brittle with their level of knowledge. Like, they can be amazing at this one thing, and then you tweak it slightly, you tweak your prompt slightly, and the performance drastically drops. And this kind of brittleness, this jaggedness, it doesn't really lend itself to authority very well. I like the idea of giving people autonomy and agency over their healthcare with things like internet search and with LLMs. I do think though we just need to approach that with caution and make sure that those tools that we use are as validated as they can be. And I wanted to finish off this video with a little personal reflection on getting an adult ADHD diagnosis at 22. I'm 27 now, just for reference, and when I got that diagnosis, I didn't really do any treatment after. You know, like, I did therapy for like 5-6 months, a couple years after, but it wasn't directly related to the ADHD, and I've never been on medication for it. But I felt like getting that diagnosis was really, really important for me, just feeling calmer on a day-to-day. There's a lot of truth, I feel like, to the mechanisms that they describe, that feeling of like having a community. Not that I've gone out of my way to find it, but like, you know, just naturally I feel a bit more open talking about it, and you just connect with some certain people who have it. It wasn't a fully positive effect at the start, where I felt like I didn't have any shame about having it per se, but I know that there is this negative perception of people with ADHD as not being able to get stuff done. And I didn't want to tell people so that they didn't over associate me with that kind of person, or like make that snap judgment about me. I suppose maybe in a way that is kind of shame, but I feel like I got over that fairly quickly, you know. Like, the way I describe it is probably, if I was at 80% before getting that diagnosis, after initially getting it, it was a bit like you reevaluate a lot of situations you've been in your life and kind of maybe feel a bit of guilt, a bit of shame about it, and then you don't really want to tell people, don't want them to over associate it with you. And I kind of went down to 75%, 70%. But then by the end of that year, you know, after a few months, I feel like I went up to like 85%, thinking like, you know what, I've actually done pretty well, despite, or maybe even because of having this diagnosis, that I actually kind of like wearing this label on me. I'm not wearing it heavily, like it's not who I am, but it's a part of me. And since that time, since I was 23, 24, it's just steadily progressed. And I feel like now I'm probably at 90%. So 80, then 75, then 85, then 90. And I feel like it's only going to go up, like slowly and probably slower than before, but still going up. I think there is also one bit of nuance there, which is that, you know, I received that diagnosis at the age of 22. I'm not sure if I would have wanted to receive that when I was younger, because It's weird because I feel like I've always been a confident person, but maybe my like sense of self wasn't as stable basically when I was younger, that if I'd had that diagnosis then, it might have been that kind of self-fulfilling prophecy thing, or I might have over-associated my own self with it. And then also because I never got it, I was able to build up, I wouldn't even say coping mechanisms, I just feel like, you know, strategies that kind of work for me in terms of revising for exams and kind of how I do my to-do list and how I exercise and all these other things, right? I kind of just figured it out for myself, that by the time I got that diagnosis, it was like, you know what, I'm in a good position. It's nice to know this, it's nice to have this community or nice to have this fallback, but I don't need to associate myself too heavily with it. So I'm not like a proper medical professional or anything, right? So I don't want to give too concrete advice, so obviously take what I'm saying with a pinch of salt. But if you're someone who suspects that you're suffering from some kind of psychiatric ailment, I would say it's worth getting a diagnosis. I mean, there's a lot of resources out there for it now. I feel like it was kind of our generation's thing to help kind of figure out this mental health thing. And it feels like it's part of modern culture now that people take consideration of mental health. They actually have like drugs for it, they have therapy groups, they have community groups. There are so many other things that help out for it, right? That it feels worth it. It's a bit different, I feel like, if it's a condition that doesn't have a treatment yet, because I don't know how I would feel if I didn't know there was some option of going on drugs or something like that. Like if you got diagnosed with a cancer but there was no treatment, would you want to know? Probably still, because then maybe you would live out the last few months, years of your life with a different flavor. But I don't know, and that's why I don't want to give too concrete advice. But I think for these kind of fuzzier and more fluid areas of medicine, psychiatric medicine, chronic pain as well, like those kinds of things, I think really benefit from getting a label put on it. And you know, so if you do go and get that assessment and you get that confirmation, you get the diagnosis, the one piece of advice that I can say is that accept it and like try and embrace it, but learn also not to wear it too heavily. Like wear it lightly as one part of yourself but not who you are, and I think just use it as a tool that can give yourself a bit more grace.